Hi everyone. Today's Toolbox Talk is on health hazards. Thank you for joining us. Um, the purpose of this talk is to make sure that everyone understands what health hazards are, how they present in our workplace, how they harm us, both long and short term, what controls must be put in place every time, and our responsibilities under the law. More workers die each year from work-related health than accidents, and it's a very key area that people are need to focus on as organisations. It's been particularly a area of focus from the health and safety executive of late, and you'll see lots of campaigns in place relating to health hazards and how organisations are managing them. So, what are health hazards? They can be anything that can cause long-term illness or harm, such as exposure to dusts, fumes and gases, noise, vibration, chemicals, manual handling or poor ergonomics, exposure to bacteria hazards, viruses, wastes, etc., and even exposure to sun. Not that we'll see much of it this time of year. Uh, The legal duties, well, there's various regulations, the Health and Safety at Work Act, of course, the management regulations, COSH, vibration, noise, manual handling, PPE, and the control of asbestos. And these regulations will stipulate what the workers must follow, the sort of training required, the control measures, PPE requirements, and how you'd raise concerns. So any organisation under the management regs is required to carry out a suitable and sufficient risk assessment. They must identify the hazards, um, assess how workers may be harmed by that, and look at the hierarchy of control, which we'll look at later on. They need to brief workers and check their understanding and review things regularly to make sure that you aren't doing any damage to individuals. And it's that review process that is key, really, and that's where sort of occupational health provisions also come in place to make sure that your control measures are working. So there is a hierarchy of control, and that is eliminate, substitute, engineering controls, administration controls, and then PPE is the last resort. And quite often, organisations will go for PPE as the first resort, but quite clearly in the hierarchy of control, you need to put in other measures and actually prevent the exposure if you can first, rather than just trying to protect at the end. So the sort of controls measures that you put in place, so respiratory hazards, dust and fumes, you'd look at things like on-tool extraction, use of H-class vacuum cleaners, for example, rather than sweeping. For face fit testing of RPE, say FFP3 filters. You might carry out air monitoring, and you would also look at damping down environments for dust and that sort of stuff. For noise, you'd look at quieter tools and isolation barriers. You'd limit exposure to individuals, hearing protection zones, and for health surveillance, audiometry testing uh, to make sure that you're not doing damage to the worker. And also, you'd look at the exposure times and limits to make sure that the daily personal exposure is not exceeded. Vibration in a similar way to noise. You'd look at equipment maintenance and the tools that you're using. You'd look at trigger time and exposure levels. You'd look at vibration health checks, and sort of early sort of warnings of vibration, white finger, tingling of the fingers, and all those sort of things. In terms of COSH and chemicals, you'd look at the correct handling and use of the substances and what material safety data and COSH data sheets say. Make sure that any provisions, such as gloves, are matched to the right sort of chemicals. You'd look at the way that you work and prevent exposure, duration times, good health and hygiene practices, and remove contaminated clothing quickly. In terms of manual handling, you'd try and avoid manual handling, look at mechanical aids wherever possible, keep loads as close to the individual and avoid twisting, and pre-plan the routes, and report any consistent pain from the individuals. For biological hazards, then you'd be looking at vaccinations, um, making sure there's good hygiene practices on site, cleaning cuts, etc. So occupational health surveillance, well, how do you know that you're not damaging the individual workers? Well, part and parcel of that process is the use of occupational health. So they carry out various sorts of assessments, from hearing assessments, lung function tests, hand-arm vibration monitoring, skin checks, even asbestos medicals. Generally speaking, health surveillance can be done through your local NHS hospital, but there's also private providers as well. Some may also be able to come out onto site and do the checks from the site itself. The frequency and the type of assessments will vary depending on the individuals, the histories of the individuals and the cases, and what sort of work activities that they're doing. But it's important that the occupational health providers understand the jobs that the individuals are doing, potential exposures, outcomes from any risk assessments that you have. So it all feeds into the right mechanisms so they can get a good occupational health plan in place. So as an organisation, what should you do if any of your workers experience any issues? Well, key is to stop work immediately and investigate and ask questions as to what they're experiencing. Um, you can have regular questionnaires to try and get information from them, or it might be that you see dermatitis or something like that on the shop floor. So um, you, what you don't want to do is to increase the damage. Look at the jobs they're doing and the exposure. Can you eliminate them? Can you switch the jobs that they're doing in the short term until you investigate further, seek medical attention and an evaluation? So in terms of responsibilities, workers, they have a duty of care to themselves and others. They have to make sure that they work in accordance with their RAMs and risk assessments, that they do not expose themselves to chemicals or uh, other types of risk, that they're working in accordance with their documentation, exposure times, and not shortcutting the activities they're doing. They need to be able to highlight to the management where they believe that there's issues, so it can be escalated further and investigated. Supervisors need to be able to monitor the implementation of control measures and the implementation of the risk assessments themselves, to be aware of any issues that may come about. And then management as a whole need to be able to take things further, put in place an occupational health program where appropriate, be aware of any changes of processes or work activities, or even any vulnerable groups within the organisation that they need to increase the level of health surveillance. So to take away from this toolbox talk, health surveillance is a key topic. It affects quite a lot of people, and in fact more health related issues than accidents in terms of the HSE. The HSE will enforce where companies aren't implementing the correct control measures and where they're doing damage to workers' healths. Be aware of what each individual regulation is talking about. Make sure that where there are exposure limits such as noise and vibrations, that you're monitoring those and looking at daily personal exposures to make sure that people's healths aren't being affected. And above all, be vigilant. Respond to actually workers reporting issues. look at the wider picture and implement and monitor and review. That concludes this Toolbox talk this morning. Many thanks for your attendance.